So your doctor prescribed gabapentin or pregabalin, and you're probably thinking, okay, what exactly is this supposed to do inside my body? And you know what? That is an excellent question. The whole point of this is to walk you through it, to give you a really clear and I hope reassuring guide to how these medications can help bring you some relief.
I mean, we've all had aches and pains, but this is different, isn't it? It's not like a simple bruise. This is a kind of pain that feels like it has a life of its own. That burning or tingling or shooting feeling that seems to come from deep inside. It can be so confusing and, honestly, really frustrating. And I want you to know, if you're feeling that, you are definitely not alone.
So what's going on here? Well, in medical terms, we call this neuropathic pain. But let's ditch the jargon. The best way I've found to explain it is to think of your nerves like a car alarm system. A good car alarm only goes off when someone's actually trying to break in, right? But with neuropathic pain, it's like that alarm has become way too sensitive. It starts blaring at full volume if a leaf falls on the hood, or sometimes for no reason at all. The key thing to understand is that the problem isn't with the car, your body part, it's with the faulty, oversensitive alarm system itself.
And when that alarm system is going haywire, we say the nerves are hyperexcited. It basically means your nerve cells are just firing off these loud, constant pain signals to your brain over and over again. It's like they're stuck in the on position, and that's what creates that relentless burning or shooting sensation.
Okay, so let's zoom in and see how this actually happens at a super tiny microscopic level. It all starts when a nerve ending gets overexcited. That excitement caused these little tiny doorways, we call them calcium channels, to just swing wide open. The moment they open, calcium floods into the nerve cell. And that rush of calcium, that's the trigger. It's what tells the nerve to release a flood of pain messengers, chemicals with names like glutamate and substance P. And it's those messengers that carry that blaring alarm signal all the way up to your brain.
Now, here's where it gets really interesting and a bit wild. What the research shows is that after a nerve has been injured, or with some chronic pain conditions, the body's response is to, well, it's to build more of these calcium channel gateways. A lot more. So not only is your alarm system already too sensitive, but your body goes and installs extra hair triggers all over the place. It just makes the whole system even more likely to go off.
And this is exactly where medications like gabapentin and pregabalin step in. The best way to picture them is as calm, steady gatekeepers. Their main job is to go to those overactive calcium channels, all those extra hair triggers, and just bring some order to the chaos. They don't slam the gate shut completely, but they help manage the flow to bring things back to a more normal, calm level.
Okay, and this is a really important point, something a lot of people get confused about. And it's totally understandable. Because of the name gabapentin, you'd think it works on something called GABA in the brain. But it actually doesn't. That's a common myth. Its real target, what it's truly designed to do, is to work directly on those calcium channels we've been talking about. That's its primary mission. So you can really see the difference it makes. Before you take the medication, you've got those channels wide open. Calcium is just pouring in, releasing a constant barrage of pain messengers. The alarm is just blaring. But after the medication is on board, it gently, partially closes those gateways. That means less calcium gets in, which means fewer pain messengers get released. It's literally like someone is reaching over and turning down the volume on that alarm.
Now, turning down the volume on pain signals sounds fantastic, right? But you're probably thinking, okay, but what does calming down the entire nervous system actually feel like? And that is the perfect question because it leads us right into talking about side effects, something I know is on a lot of people's mind.
The first thing to know is that the most common side effects are pretty much the same for both gabapentin and pregabalin. We're talking about things like feeling a bit dizzy or drowsy, maybe some swelling in your hands or feet. And it makes sense, right? The medication is bringing that calming effect to your entire nervous system, not just the part sending pain signals. So while your body is getting used to this new, quieter state, you might feel some of these things.
You know, it can be helpful to think about these side effects a little differently. In a way, they're a sign that the medicine is working. It's actually doing its job of calming things down. And they're almost always tied to the dose. The higher the dose, the more likely you might feel them. But here's the really good news. For most people, that initial dizziness or drowsiness gets a lot better or even goes away completely within the first couple of weeks. And the most important part, they can absolutely be managed.
So how do we manage them? Well, a big part of the answer comes down to understanding that while gabapentin and pregabalin are like cousins, they're not identical twins. There are some really key practical differences in how they work in your body, and that can make a huge difference in your experience.
Let's break it down. With gabapentin, you're usually taking it 3 times a day. Finding the perfect dose is a slow and steady race. It can sometimes take a couple of months to get it just right. Pregabalin, on the other hand, is usually just twice a day. Its absorption is much more predictable and consistent, which means your doctor can often find the effective dose for you a lot faster, maybe within a few weeks.
But no matter which one you're on, there is one golden rule that applies to both. Start low and go slow. This is so important. Your doctor will always start you on a very small dose, a lot of times right at bedtime, so if you do feel a little drowsy, you just sleep through it. Then, week by week, you'll slowly and gradually increase it. This gentle approach gives your body a chance to get used to the medication, and it is, without a doubt, the best way to keep those side effects to a minimum.
And listen, this isn't just a friendly tip, it's a core principle written into medical guidelines. Study after study confirms it, that dizziness and sedation we talked about can be dramatically reduced simply by starting with a lower dose and being patient with the process. A little patience right at the beginning makes a huge difference down the road. It really does.
And that's why it's so critical to see this as a partnership between you and your doctor. Finding that sweet spot, the right dose that gives you maximum relief with minimum side effects, it's a process of careful adjustment. It's a journey you're on together. This is absolutely not a one-size-fits-all prescription. Your feedback is a crucial part of getting it right.
So, we've covered a lot of ground. What's the main takeaway here? What should you really hold on to?
Here's my parting doctor's note for you. Think of these medications as a really helpful tool, like a volume knob for that oversensitive nerve alarm. And the key to making that tool work for you is simply patience, especially with that start low, go slow process. Keep the conversation going with your doctor. You're a team in this, and together you can find the relief you absolutely deserve. Welcome to the Beyond the 8 community. We're so glad to have you here.